What if the biggest reason your diabetes is hard to control is not food, exercise, or medicine, but something as simple as when and how you drink water? Before we begin, subscribe to the Vital Health channel and share this video with your friends who care about their health. I know this sounds hard to believe. You may have spent years trying everything. You tried different medicines that cause side effects. You followed strict diets that made you feel frustrated and tired. You bought glucose monitors and supplements that promised results but changed nothing. Now I am saying that simple water could be the missing piece. Stay with me, because what I am about to share has helped many people lower their fasting blood sugar in just a few weeks. My name is Dr. Boz, and today on Vital Health, I want to explain how smart hydration can improve how your cells respond to insulin, even if you have had diabetes for many years. This is not theory or lab data. These are real people I see every day, people who come in tired, confused, and worn down. Many are in their mid-60s to late 70s. They do everything right. They check their blood sugar several times a day. They know the glycemic index by heart. They carefully measure their carbohydrates. They walk after dinner. They take their medication on time every day, yet their morning blood sugar is still unpredictable. You can see the exhaustion in their faces. It is not only physical tiredness, it is the emotional weight of fighting a problem that never seems to improve. These are people who gave up bread, pasta, and sweets they once enjoyed. They spent thousands on glucose monitors, special foods, and supplements. They attended every diabetes class available, and still their A1C keeps going up. What changed my entire view on diabetes was noticing one common issue. Many adults over 65 are constantly dehydrated. This dehydration creates serious metabolic problems that make blood sugar control very difficult, no matter how strong the medication is. Most health advice talks about food. Almost no one talks about when and how to drink water. This is not about stopping your treatment. Your medications matter, and your doctor's plan is important. What I am sharing is how to improve the internal environment of your body so your treatment can actually work better. As we age, especially after 60, the body goes through changes that affect blood sugar control. The channels that move water into your cells become less responsive. Even if you drink water, your cells struggle to absorb it. Your kidneys also lose part of their filtering ability over time. This makes it harder to remove extra sugar from the blood and causes you to lose more water than you should. Another major issue is thirst. By the mid-60s, the body's thirst signal becomes delayed. You may already be dehydrated long before you feel thirsty. On top of that, many diabetes and blood pressure medicines pull water out of the body, making dehydration even worse. Here is what most people are never told. When your cells are even slightly dehydrated, they become stiff and less flexible. This makes it harder for insulin to move glucose into the cells, causing blood sugar to stay high even when you are doing everything else right, like a dry sponge versus a wet sponge. A dry sponge cannot absorb anything, but a moist sponge pulls in liquid immediately. Your cells work the same way. When your cell membranes are well hydrated, insulin receptors work properly. When they are dehydrated, those receptors slow down or shut off. Your body may be making insulin or you may be injecting it, but if your cells are dry and stiff, insulin cannot do its job. Glucose stays stuck in your bloodstream instead of moving into your cells. Your blood sugar rises not because you failed your diet or missed medicine, but because your cells physically cannot accept the glucose. Let me tell you about Robert. Robert is 69 years old. His diabetes was stable for 8 years. Then suddenly, without changing anything, his morning numbers became unpredictable. He used to wake up around 110 to 120. Now he was seeing 170, 185, sometimes over 200. His daughter brought him in because she was worried. When I reviewed his glucose log, the pattern made no sense. One morning, 192, the next 178, then 201, then 186. Same dinner every night. Chicken, vegetables, a small portion of brown rice. Same routine, same medications, but completely different morning readings. His daughter leaned forward and said he is doing everything perfectly and something must be wrong. I reviewed his entire day step by step. Wake up time, meals, medications. Everything looked correct. Then I asked one simple question. Walk me through how much water you drink in a normal day. That is when the picture became clear. He told me he drinks coffee in the morning, maybe a glass of water with his pills, another glass at dinner. and sometimes iced tea in the afternoon. When I asked about plain water, he admitted maybe 2 glasses a day. He said he never really feels thirsty, so he does not think about it. Here is the problem. At his weight, Robert needs close to 90 ounces of water each day. He was drinking maybe 16 ounces. He was deeply dehydrated, but his weakened thirst signal never warned him. Coffee also made things worse. Coffee pulls water out of the body. For every cup of coffee, you only keep a small amount of hydration. The rest comes from your own water stores. We started a simple hydration strategy that focuses on when to drink, how to drink, and the temperature of the water. 10 days later, Robert contacted me. His voice sounded different, lighter, almost excited. He told me his morning reading was 118. The day before, it was 124. A few days earlier, it was 132. He had not seen numbers like that in months. After 4 weeks, the change was obvious. His energy improved, his color looked healthier. His glucose log showed an average fasting number around 127 for 2 full weeks, down from 185. He did not change his food. He did not change his medication. The only thing that changed was how he hydrated his body. What really stayed with me was what he said next. He told me he felt clearer, more present, less foggy, like a mental haze he had accepted for years had finally lifted. That clarity comes when the brain, which is mostly water, finally gets the hydration it needs after a long time of being depleted. The details are different for everyone, but the root problem is usually the same. Before I explain the exact hydration method that works so well, I want to point out the biggest mistakes most people over 60 make with water. You are probably making at least 1 or 2 of these right now. The first mistake is counting coffee, tea, and other drinks as water. Coffee and tea cause you to lose more water than you gain. For every cup, your body gets only a small amount of real hydration. The rest is pulled from your existing water reserves. Juice, even when it is unsweetened, also creates problems because it triggers insulin and pulls water into digestion instead of your cells. Rapid blood sugar spikes that force your kidneys to flush out both glucose and water. Diet sodas are no better. Artificial sweeteners actually increase insulin resistance. The truth is simple. Plain water is the only drink that truly hydrates your cells. Everything else either helps very little or makes things worse. Think of it like this. If your bank account needs a certain balance to stay healthy, would you deposit money knowing most of it is immediately withdrawn? That is exactly what coffee and tea do to your hydration. The second big mistake is drinking very cold water, especially first thing in the morning. Cold water feels refreshing, but inside your body it causes problems. When cold water hits your stomach while your body temperature is still low from sleep, your blood vessels tighten. This reduces circulation. Glucose and insulin travel through the blood, so poor circulation means they cannot reach your cells properly. Cold water on an empty stomach also triggers a stress response. This raises cortisol, and cortisol tells your liver to release stored glucose. You can cause a blood sugar spike before eating anything. Warm or room temperature water keeps blood vessels relaxed, circulation steady, and blood sugar more stable. The third mistake is waiting until you feel thirsty and then drinking a large amount all at once. After age 60, thirst signals are delayed. By the time you feel thirsty, you are already dehydrated. Then most people drink a large glass, thinking they are fixing the problem, but your body can only absorb a small amount of water at a time. The rest goes straight through you. You did not hydrate your cells, you only stressed your bladder. True hydration comes from small amounts taken regularly, spread throughout the day. Now I want to explain the exact system I use with my patients. It focuses on the right water, the right timing, and helping your body relearn balance. First, water quality matters. If your tap water is clean, that is fine, but filtered water is better when possible. Not because of fear, but because minerals matter. Your cells need more than just water. They need electrolytes to allow glucose to move into the cell. Minerals act like keys that open the door. Without them, glucose stays outside. Magnesium is especially important for insulin function, and many people over 60 are low in it. Potassium supports healthy glucose levels. Sodium in the right amount helps water actually enter the cells. A simple solution is to use liquid trace mineral drops. Add a small amount to your water. This is inexpensive and lasts a long time. Add a few drops to each large bottle of water you drink during the day. Now let us talk about timing. The first and most important time to drink water is immediately after waking up, before coffee, before checking your phone, before anything else. As soon as you get out of bed, your body needs gentle hydration to wake up circulation, calm stress hormones, and prepare your cells to handle glucose properly for the rest of the day. Drink 12 ounces of room temperature water with minerals, not cold water and not plain water. After 7 to 8 hours without fluids, your blood becomes thicker overnight. This first glass of water rehydrates your blood so it can flow more easily and deliver insulin where it needs to go. Drinking water first thing also gently wakes up your metabolism and prevents the cortisol surge that causes the dawn phenomenon, that unexplained morning blood sugar rise. In people like Robert, this one step alone often lowers morning glucose by 30 to 35 points. That is a major drop from just drinking water at the right time. The second window is 30 minutes before each meal. Drink 8 ounces exactly 30 minutes before breakfast, lunch, and dinner. Not right before eating and not too early. This timing allows your stomach to prepare properly. It activates digestive enzymes and creates the right environment for digestion. Most importantly, it slows how fast food leaves your stomach. When carbohydrates enter the bloodstream slowly, blood sugar rises gently instead of spiking. This allows your insulin to keep up. This habit alone can reduce after-meal blood sugar spikes by up to 35%. The third window is mid-morning and mid-afternoon between meals. Many people see unexplained blood sugar rises during these times. The reason is dehydration. As your blood loses water, glucose becomes more concentrated even if you have not eaten. Drinking 6 to 8 ounces around mid-morning and again mid-afternoon keeps blood volume stable and prevents these sudden rises. Small amounts at the right time make a big difference. The fourth window is 2 to 3 hours after your last meal. Drinking water too close to bedtime can disrupt sleep, but drinking earlier in the evening allows your body to absorb and distribute that water properly. This prevents excessive thickening of the blood overnight and leads to more stable fasting glucose in the morning. Most people can sleep through the night without bathroom interruptions when timing is done correctly. Here is something very important to understand. Your body adapts to long-term dehydration. When you start drinking more water, you may need the bathroom more often at first. This is normal. Your body is recalibrating. Many people stop after a few days because it feels inconvenient. But if you continue for 10 to 14 days, your kidneys adjust, your bladder adapts, and your cells begin holding water properly. Bathroom urgency decreases while true hydration improves. This is how your body leaves survival mode and returns to balance. When you drink water on a consistent schedule, your body also learns the pattern. Your internal clock begins to anticipate hydration, circulation improves, stress hormones stay lower, and blood sugar becomes easier to control. This is how strategic hydration supports better glucose numbers without changing food or medication. Hydration windows and prepares your metabolism in advance. Over time, this creates very stable blood sugar patterns. So what can you realistically expect when you follow this hydration approach? Let me walk you through it week by week so you know exactly what is normal. During week 1, you will be using the bathroom more often. I want to be honest about that. It can be annoying, but it is temporary. Your body is flushing out waste that has built up over a long time. Blood sugar changes in this first week are usually small, maybe 5 to 10 points lower on average. Some people feel a bit more energy, but most only notice the extra bathroom trips. In week 2, bathroom frequency begins to normalize. By day 10 or 11, most people are no longer constantly searching for a restroom. Blood sugar readings start to look more consistent. They may not be dramatically lower yet, but they are less random. The gap between your highest and lowest readings each day starts shrinking. Week 3 is when many people have their breakthrough. Morning fasting glucose often drops by 15 to 25 points compared to previous averages. After meal spikes become calmer and more predictable. This is also when people start to feel different. Mental clarity improves. Afternoon energy crashes ease. Some even notice less joint pain because proper hydration reduces inflammation. By week 4 and beyond, blood sugar control continues to improve. Over 3 months, many people see their A1C drop by about half to nearly 1 full point. Under a doctor's supervision, some are even able to reduce medication doses. Many people say they have not seen a reading over 160 in weeks, when before they were over 180 almost every day. Let me tell you about Linda. Linda is 73 years old and had been living with type 2 diabetes for 16 years. When she came to see me, she looked defeated. She told me her endocrinologist wanted her to start insulin. Her A1C had climbed from 7.8 to 8.9 in just 6 months. She was already taking 3 oral medications and felt like she was failing. She admitted she was terrified of needles, and the idea of daily injections overwhelmed her. When I looked closer, her daily water intake was extremely low. Her urine was dark. Her skin showed signs of long-term dehydration. She complained of constant fatigue. When I explained the hydration protocol, she was skeptical. Water sounded far too simple, but she was willing to try anything to avoid insulin. The first week was difficult. She contacted me saying she felt like she lived in the bathroom. I encouraged her to continue. By the second week, things changed. Bathroom trips slowed down. She slept through the night for the first time in months. Her morning blood sugar dropped to 148 when it had not been under 175 in over half a year. By week 3, she came in for a follow-up visit. The difference was obvious. Her skin looked healthier. Her eyes were brighter. Her movement was easier. She showed me her glucose log. Her average fasting number that week was 139. After meals, her readings rarely went above 165. Before this, she often spiked over 220 after eating. After 3 months, we checked her A1C again. It had dropped from 8.9 to 7.7. Not perfect, but a major improvement. Her endocrinologist even called to say they were postponing insulin. If the trend continued, they might reduce one of her medications. What Linda told me next sums this up perfectly. She said she spent 16 years carefully managing food, exercise, and medication, but ignored the most basic thing her body needed: water. Running on empty and expecting her body to perform perfectly. 6 months later, her A1C is down to 7.2. The insulin discussion is completely off the table. She avoided the injections she feared by focusing on water, timing, and consistency. This is a powerful reminder that sometimes the most basic needs are overlooked while attention stays on complicated solutions. Now I want to be very clear about something important. This approach is not a cure for diabetes. It does not replace your medications. You should never stop or change any prescribed treatment without clear approval from your doctor. What this method does is improve the internal environment of your body so your medications can work better and your natural insulin response can function more efficiently. There are important precautions to understand. If you have congestive heart failure or any condition where fluid retention is an issue, you must speak with your cardiologist before increasing water intake. In some heart conditions, too much water can cause problems. If you have kidney disease, especially advanced kidney disease, or are on dialysis, do not increase water intake without guidance from your nephrologist. If you are taking diuretics for blood pressure or heart conditions, your doctor may need to adjust your dose as hydration improves. Better hydration can naturally lower blood pressure, which is good, but it can make some medications too strong. Pay attention to your body. Overhydration is uncommon, but if you are urinating very frequently with completely clear urine all day, or if you develop headaches or nausea, reduce your intake slightly. Balance is the goal. I would love to hear your experience. Share in the comments where you are starting from. Let me know what you notice after week 1, week 2, and week 3. Your experience could help someone else take the first step. If you watch this entire video, type "I finished the video" in the comments. It helps Vital Health reach more people who are struggling with blood sugar control. Are you ready to try this approach? What concerns do you have about starting? I read every comment and do my best to respond. If this video helped you, please share it with a parent, friend, or spouse who is doing everything right but still struggling. This simple information could truly make a difference in their life. And if you have not subscribed yet, subscribe to the Vital Health channel and share this video with other friends. I post new videos every week focused on diabetes, metabolic health, and staying well after 60. Thank you for being here. Thank you for caring enough about your health to stay to the end. Remember, powerful change often comes from getting the basics right. Take care of yourself. This is Dr. Boz, and I will see you in the next video on vital health.